Indiana's 29th district sits at the edge of change. It wraps around Indianapolis from Zionsville and West Clay, down through Claremont and along communities shaped by proximity to the city, not defined by it. This is a district where growth is constant. New neighbors, rising home values, expanding schools. But with growth comes pressure. Traffic that builds faster than roads. Schools trying to keep up with enrollment. Families asking whether the cost of living is moving faster than their paychecks. And beneath it all, the bigger question, who decides the future of these communities? Local voters or state lawmakers miles away? Welcome to Hold 'em Accountable. Tonight's guest believes State Senate District 29 deserves leadership that protects local voices while planning for the future. Our guest tonight is Kristina Moorhead, a Democratic candidate for Indiana State Senate District 29, a district that surrounds Indianapolis from Zionsville and West Clay down through Claremont and across communities just north of the airport. District 29 represents a unique part of Indiana, a suburban ring where rapid growth, strong schools, and rising cost are all colliding at once. Moorhead is stepping into this race with a focus on public education, affordability, healthcare access, and preserving local decision-making in communities that are growing quickly and demanding more from state government. This is a district where voters expect responsiveness, where school policy is front and center, and where the balance between growth and quality of life matters deeply. Tonight, we're going to ask her what her priorities will look like in the State House, how she would represent a fast-changing district, and what accountability means in District 29. Kristina, welcome to Hold 'em Accountable.
Thank you, Derek. Thank you for having me on your show.
District 29 is experiencing rapid suburban growth. What infrastructure investments should the state prioritize to keep up?
Great question, Derek. So the first thing I think that comes to mind for all of District 29 are roads. And we see in Carmel, so I live in Carmel, we see in Carmel now, there's a lot of home growth. There's a lot of home growth in Zionsville too. So I think making sure that our roads are wide enough and big enough for people just to travel around town. In Indianapolis, I think roads are also needed. If you know anything about how roads are funded in Indiana, it disadvantages Indianapolis. And Indianapolis, as really our greatest economic city within the state, 26% of the gross domestic product out of the state. Our roads there need a lot of work and a lot of help. And the funding formula, I think, has disadvantaged Indianapolis over time because it is a Democratic stronghold within the state. I think it's a bit of a punishment to Indianapolis, but I think the road structure in Indianapolis and the surrounding Zionsville and Carmel, that's what I would focus on for infrastructure.
Schools in Zionsville and surrounding areas face increasing enrollment pressure. What changes would you advocate for in education funding?
Well, Derek, the first thing I think is we need to fully fund our public education schools. So Zionsville recently announced that they have a $3.18 million shortfall. That's $412 per student. And that 3.18 sounds like a lot of money, but when I also heard it was $412 per student, that's big within a school district. We see our proficiency scores in our district and really across Indiana in writing and math and reading. They're really just not acceptable. We're not statewide even meeting, majority of students meeting that goal. So I think the first step is just to fully fund our public education. And when I say our public education, I really mean our public schools. I think we have to look at charter schools and our voucher system differently than our public schools. I'd like to separate the two and really focus on funding our public schools first, and then looking at a different pot of money for charter schools in the voucher system. I'm not sure that we can, at this point in time, totally stop charter schools and vouchers. We're over a decade into this policy at this point in time, so a hard stop would be very difficult. So I think we need to really start looking at two different pots of money to make sure that our traditional public schools are fully funded, and then look at the vouchers and charter schools a little differently.
Property taxes are rising in suburban districts. What reforms, if any, What do you support?
I support a total rehaul of our property tax system. I've been looking at property taxes. What's the base formula that we're using? What are all the different tax credits that are stacked up upon it? And I think it's time that we do the really difficult work of looking at what should our property taxes be and go back to the base formula instead of looking at consistently, another cut, cut. And then local governments are doing referendums to pay for schools and local services. So I think that's a very difficult project, but I think it's time that our legislature steps up and looks at the base formula for property taxes and reevaluates the base instead of just adding more tax credits to it.
Many residents commute into Indianapolis. What transportation improvements should the state focus on?
I would love to see some sort of fast lane, bus system, light rail from Carmel, Zionsville to downtown Indianapolis. I think we would have to do surveys first to understand who's interested in that. Is there enough interest to make it worth your while financially? But I'm sure a lot of people feel the same way as I do when you're traveling down Meridian Street trying to get to Indianapolis, and it's a 45-minute commute for not a lot of miles, and faster transportation would be awesome.
Local control has become a major issue, especially in school policy. Where do you draw the line between state authority and local decision making?
I think we need to allow our local governments and local government officials to do the job that they were elected to do. I disagree with policies that have passed in Indianapolis with the school board, trying to overtake certain pieces of local government. Same has happened up here with Carmel. We recently had the state enact policy that says Carmel can't implement a rental cap. I think whether you agree or disagree with the rental cap, I still have an issue with the state coming in and saying that, what the city county council and what the mayor decided upon, they cannot do. So I think we have to protect our local governments and allow them to do the job that they were elected to do.
Housing affordability is becoming a concern even in traditionally higher income suburbs. What role should the state play?
I think the state has a role to play. So I live in Carmel. We have a housing shortage here in Carmel, same as over in Zionsville. Indianapolis in some areas does as well. I think we need to look at why there's a housing shortage in Carmel and Zionsville. And, people want to move here because we have great schools, great amenities. And I think we need to start looking at how can we duplicate that in other places around Indiana. Instead of thinking about, how can we change the housing situation in Carmel and Zionsville? Maybe we need to do that somewhat. At some point, there's just no more room for more housing. And I think the easier solution is to look at other parts of Indiana and not necessarily the more suburban or even rural areas and developing those. Like, how can we redevelop some of our urban areas to have some of the amenities and culture that people are seeking in other places? I think that's a state and local partnership. I don't think it's just state. I don't think we want states to step into localities and say, this is what you should be doing. But I think it's the state offering, funding to localities to build different types of amenities, to improve their schools, to attract new homeowners to those places.
Healthcare costs remains a concern for families across the district. What state level action comes first?
Oh, I have a lot of thoughts on this, Derek. I think the first, and there's different types of health coverage with this as well. So if I'm looking at the commercial market, some things that I'd like to see would be surrounding commercial insurance that's state regulated. We see a lot of health insurance plans that are publicly traded plans. To me, that you have a question that naturally comes for that. Are they working for their shareholders? Are they working for their employers and for the customers who are purchasing their insurance? I would like to see more legislation around, and it's not exactly fiduciary duty, but it's fiduciary-like duty to ensure that they are representing the employers and the workers that are buying the insurance first before they are worried about the profit that they're giving back to their shareholders. I think that would be a big change. You could also look at making health plans, and I don't think you totally revamp the system for this, but not-for-profit health plans, I think, would be another good start for assuring that the decisions that they're making make patients come first. We see a lot of issues with utilization management, prior authorization. Patients can't get the surgery that they need or the medicine that they need because we're making financial decisions instead of decisions about what the patient actually needs access to. So I think that would be a big first step. Another area for state government would be Medicaid. I'd like to see, and some of this is part of the big beautiful bill that passed by the federal government. So the state does have some parameters around this, but making sure that our Medicaid beneficiaries are able to stay on Medicaid as long as they are eligible for Medicaid. So we see these policies that have passed requiring more frequent eligibility determinations. They are going to kick people off that are eligible for Medicaid because they didn't return a paper, or perhaps they've changed their phone number. And the state is really doing this in a punitive way right now, just to kick folks off of Medicaid. But we see when folks are able to stay on Medicaid, we have better health outcomes. They are not churning back and forth as much. They are able to take their mental health medication more consistently. They are able to go to their therapy sessions more consistently. They aren't ending up in the emergency room. And what we see happens when someone's churning on and off the program, and there's actually retroactive eligibility for Medicaid, is they're off the program, they're seeking emergency services, their healthcare costs are more expensive, and then Medicaid, once we finally figured out they were actually eligible for that whole period of time, we're back paying for all of those expensive services as well. So I have a lot of thoughts on healthcare, but those are kind of top two for both commercial and the Medicaid areas of our state.
When you are talking about like nonprofit insurance,
Mm-hmm.
there's many lawmakers that are proposing the expansion of the Healthy Indiana plan. I mean, was Mike Pence's answer to the ACA. And I mean, there's hits and misses with Healthy Indiana. Would you propose as a state senator to expand the Healthy Indiana plan to more Hoosiers?
Can I ask a follow-up on that, Derek? Are you wanting to expand it as Medicaid, or you're just wanting to expand the network of the Healthy Indiana plan?
Well, there's like 3 different options for Healthy Indiana plan.
You're talking about with the different types of health insurance coverage, like
Yeah.
who's actually providing it. Okay.
Yeah.
Yes. So I would support expanding the Healthy Indiana plan. And the first step you can actually do with that is something a handful of states have done with the federal government. It's called a basic health plan. So it's really for that group in between Medicaid and the ACA marketplace. And it provides there's less copays, there's less out-of-pocket sharing with it. It may look more like Medicaid. Medicaid has very robust healthcare services that usually aren't all offered under commercial insurance. So that would be a first step for me with that. The second piece with that is, I think, pairing up in the ACA marketplace. And we've seen a lot of the plans who offer the Healthy Indiana plan for Medicaid also may have a product on the exchange. So I think allowing folks to have kind of a continuum of care there, because we see income fluctuations and someone may be moving back and forth between Healthy Indiana plan that's Medicaid, Healthy Indiana plan that's the individual insurance marketplace. So I would support that as well. We've seen, I think, some states trying to step in as the subsidies have gone away to help consumers purchase those subsidies. I think that's really important too. Another aspect of that I think as part of the Medicaid Healthy Indiana plan that's really important, that's not in commercial health insurance right now, are high deductible health plans. We have seen high deductible health plans and those deductibles grow astronomically over time, where families' high deductible health plan may mean you have a $10,000, $15,000 deductible. And when people can't afford a $1,000 emergency out-of-pocket expense, there's no way they're affording a $10,000, $15,000 deductible. That's where we see the GoFundMe show up of people saying, it's January, I've got to buy my medicine, and they have a specialty medicine that does cost tens of thousands of dollars, and they're relying on their neighbors to help meet their deductible so they can access their health care. So another piece of that I would carry over that's from the Healthy Indiana plan is, I don't think it's going to happen, but pie in the sky, state regulated health insurance. I would say we don't need to do high deductible health plans because people can't really shop for health insurance. That's the selling point of high deductible health plans. But if you look around, there's not a way to shop for health coverage the same way that you can shop for a good car price, or you can shop for a home that fits your needs. It's just a totally different marketplace. So I think getting rid of the high deductible health plans and getting back to copays and coinsurance and monthly premiums that people can budget for is really important. So if I was expanding the Healthy Indiana plan, that would be another aspect I would look to kind of continue out.
Small businesses in suburban corridors face both growth opportunities and competition. How would you support them?
That's a great question for small business. My husband operates a small business. I'm going to say small business because it's under 100 employees. And how do we support our small businesses here in Indiana? He would say it's less about funding, and he would say it's more about building communities that people want to live in. He's able to fundraise and get money from all different types of, sources around the country. He has trouble attracting employees who want to live in Indiana because a lot of the social policies that we pass. So, he would say, repealing things like the abortion ban, making our state more LGBTQ friendly, that so that people actually want to live here in the state, making sure that our schools have better outcomes for our children, so that people want to come here and raise their kids here. Our low cost of living is already an attraction for bringing people here, but our social policies make a lot of people not want to live here. So I think it is funding small business, but from his perspective, he would say right now the social policies prohibit or make people choose that they don't want to live here.
As a Democrat in a likely Republican controlled Senate, how
Mhm.
would you pass legislation that produces real results?
I think there's a couple ways that you pass legislation that produces real world results. I think the first is that you have to have Republican friends who will co sponsor a bill with you. So you have to find bipartisan issues that folks are willing to work with you on. There's a few that come to mind for me that I think are good possibilities. So childcare is one. We see childcare as a huge issue for both employers and employees across the state. Childcare monthly payments are higher than 4-year tuition payments for Hoosiers. So that is making Hoosiers choose different job and career paths than they may have chosen otherwise. If they're saying, we're I'm working nights, my husband's working days, so that we don't have to pay for childcare because we can't afford it. I'm not taking my next promotion because if I do, I need extra childcare that I can't afford right now. So I think that is really, to me, a bipartisan issue because we also hear it from employers in the state that they can't hire the people that they need because there are childcare issues. The ROI on paying for childcare is awesome, actually. So it's not just that we're paying out for childcare, and childcare can look like a lot of different things. It can look like universal childcare, it can look like a voucher system, it could look like tax credits. So there's a lot of different options that I think we have to play with here. But it's really a bipartisan issue because we should all want employers to be growing and they should be paying higher wages to their employees. And that's an issue that employers can get behind. And it's an issue a lot of Hoosiers who have small children can get behind because they're facing, thousands of dollars a month in childcare that they just can't afford.
And finally, probably the most important question I'm going to ask you today: why you and why now?
Great question, Derek. So I bring 20 years of state policy experience to the table, mainly working on healthcare policy both here in Indiana and across the country. So I have led Medicaid agencies. I have worked for AARP advocating for older adult patients. I have worked on prescription drug issues, lowering the cost of patients specifically here in Indiana. Starting in 2023, we've passed 3 bills that lower costs because we're requiring health insurance and pharmacy benefit managers to share the discounts with patients now. We're requiring health insurance and pharmacy benefit managers to recognize assistance a patient may receive from a third party and apply that to their deductible to lower their deductible. So I have real world experience on passing bills and working for actual patients, actual Hoosiers in the state. I have experience leading government and looking at $1 billion, $6 billion actually, Medicaid budget and thinking about how can we stretch scarce resources across to provide the most that we can for Hoosiers who rely on that program. I'm also a mom and I've got 3 kids. We've got a 6th grader, pre-kindergartner, and a 5-month-old. So we're in the thick of it here. So I'm really invested in what the future of Indiana looks like for my children, and that's across their education. And we're talking about preschool all the way through college. Because I want to live here for my whole life, and I want my kids to move back here too, and I want them to be here so I can, help raise my grandkids someday too. So I think between being a mom and having 20 years of state policy experience, that's something that makes me stand out against my competitors in Senate District 29.
Kristina, we've talked about growth, schools, taxes, and local control. Now it's time to simplify things. No speeches, no long explanations. This is hold 'em or fold 'em. You agree, you fold them. You disagree, you fold them. You ready?
I'm ready.
Let's deal the cards. Healthcare should be treated as a human right with movement toward universal public coverage.
Hold 'em.
State government should reduce regulations on businesses to encourage economic growth, even if it means fewer environmental or labor protections.
Hold 'em.
Workers should have stronger protections to unionize.
Oh, hold 'em.
Candidates should refuse corporate PAC or questionable donor money.
Hold 'em if it's questionable. Yes.
Parents should have expanded school choice options, including vouchers and charter schools, even if it redirects funding away from traditional public schools.
Fold 'em.
The state should limit interference in locally elected school boards.
Limit interference. Hold 'em.
Indiana should prioritize cutting taxes and limiting government spending, even if it means slowing new investments in programs like housing, healthcare, or education.
Fold 'em.
Housing affordability requires expanded workforce housing and smart zoning policies.
Hold 'em.
Mental health services deserve significantly increased state funding.
Definitely hold 'em.
Elected officials should be willing to challenge their own party when constituents' needs demand it.
Absolutely hold 'em.
Kristina, District 29 is one of the fastest changing areas in Indiana. From Zionsville's historic streets to growing neighborhoods in West Clay, down through Claremont and communities near the airport, this district is expanding, evolving, and asking more from its leadership. Growth can be an opportunity, but only if it's managed well. Families here are investing in their future, buying homes, raising kids, building businesses. They want schools that keep up, infrastructure that works, and a voice in the decisions that shape their communities. Whatever voters ultimately decide, thank you for stepping forward and making your case. And to everyone watching and listening here in Indiana, across the country, and to our friends joining us from around the globe, democracy grows just like communities do, through participation, conversation, and accountability. So stay informed, ask questions, and as always, hold them accountable.